Hi, my name is Jim and I'm a respiratory therapist. Today I'm going to show you how to insert the nasopharyngeal airway. Okay, I have some examples here on the table. So the nasal airways they're sterile inside the package, and the way to keep them sterile would be to just open the package and then use sterile gauze with the lubricant on it to put it onto the airway, and then you can just hold the end so that basically the portion that's going into the patient would remain sterile. The lubricant would go onto the sterile 4x4. And then you would just take the nasopharyngeal airway and just spin it on there to get the lube to go all the way around. And then the measurement of the nasopharyngeal airway is from the nares itself to the bottom of the ear. So if you laid that across there, that would make that one the correct size. And then the other component is you have to look at what size the nares are that's going in. You want to use the largest one possible for the size of the nares. And when you're going into the nose, realize that the bottom of the nasal passage is the widest part, so you want to actually go straight in following the roof of the mouth. A lot of people tend to go up. The further up you go, the tighter it gets, so it's actually tolerated better if you go straight down. So I'm going to put this into one side, going straight down following the roof of the mouth. When it's going in, you want to ensure that you're not going against any pressure. You don't want to force it in. If you come against resistance and you push it past the resistance, you'll often cause a nosebleed, which will make things more difficult. So if you find that on one side that it's tight, just take it out, put it in the other side. A lot of people have a septum that's deviated in one way. You can't really tell by looking from the outside, but on the inside, one side should be loose and the other side should be tight. Put it in the side that it fits in best. Ideally, you would use the oropharyngeal airway, particularly if you're trying to bag somebody, but in cases where the patient has a gag reflex, you won't be able to use the oropharyngeal airway. So at that point, you may choose the nasopharyngeal airway. There are some benefits to using it, but there are also some risks. So what can happen is if you put it in incorrectly or you force it in, you can cause a nosebleed. Be careful, particularly in people that are consumed large amounts of alcohol. A lot of times their bleeding factors make that more at risk for nasopharyngeal bleeds. Particularly if you've done a blood sugar on the patient, you find that they bleed very heavily from that finger poke. Those would be people that'd be really cautious about using a nasopharyngeal airway in.